I'm Congresswoman Debbie Dingell, and I am glad to welcome you to the National Cancer Prevention Workshop this year. Since 2013, this workshop has been held as part of the National Cancer Prevention Day and has become a very critical effort of the United States Bipartisan Congressional Cancer Prevention Caucus, which I helped found shortly after arriving in the Congress. In the past year, we've seen how policy and education can impact and influence public health. We have learned about ways we can protect our own health and the health of our neighbors with basic measures like washing our hands, covering our mouths, cleaning our belongings, wearing masks. But we already knew that many of those same tools work to lower other health risks, including cancer. And that's because for the last several years, Less Cancer has been discussing those efforts at this event with leading experts and organizations that join our fight to reduce the incidence of cancer. Teaching people what things and their personal habits, the foods they eat, the places they go, the air they breathe, that may be contributing. And though we are getting better at treating and sometimes curing cancer, we're still looking at increased rates of cancer every year. Many factors that increase the risk of cancer are preventable and unnecessary. And that's why I've taken the fight to ban forever chemicals, PFAS and PFOS, to the Congress. We're going to get it done this year. But together, with both education and action in the legislature, we can make a difference in tapping down cancer. Let's keep doing it together.
Hello, I'm Bill Couzens, founder of Less Cancer, and today's National Cancer Prevention Workshop 2021. This year is virtual, and we will be reaching a global audience of participants. Today's workshop can also be found on Coursera, where participants can register for a certificate and/or continuing medical education credits for physicians, nurses, and public health professionals. Thank you for joining us today. A special thanks to the University of Virginia's team for continuing medical education. We are especially grateful to Chairwoman Dr. Jann Balmer and her leadership, and doctors Kathryn Reid and Andrea Zimmerman and Kathleen Haden. Special thanks to Andrea Zimmerman for her leadership in helping to navigate the workshop, especially in these unheard times of COVID. Thank you all.
Whether you're joining us from work, your home office, school, or on the go, thanks so much for tuning in to this year's virtual National Cancer Prevention Workshop. My name is Dr. Andrea Zimmerman, and I'm a learning engineer at the University of Virginia Office of Continuing Medical Education. This year's workshop does provide continuing education credits. You can find the program and more information about claiming your CE at the link below the video, or visit cmevillage.com and click syllabus. Next up, we have Dr. Jann Balmer, the Director of the Office of Continuing Medical Education and Chairwoman of the Less Cancer Board. Thanks so much for joining us today.
Hello, my name is Jann Balmer. I'm the current chair of the Board of Directors for the Next Generations Foundation, more commonly known as Less Cancer. We are dedicated to exploring and addressing topics that are focused on cancer prevention. And a number of our board members are serving as speakers and moderators for this workshop. I'm also the Director for Continuing Medical Education at the University of Virginia. Today's program, the 2021 Cancer Prevention Workshop, focuses on contemporary and relevant issues that affect the incidence of cancer, as well as our current knowledge about how we can mitigate some of those risks to prevent cancer. This work requires expertise and commitment from individuals and teams with varied backgrounds and reflects the benefits of interprofessional collaboration as a core element in fostering discussions about cancer prevention. As a reflection of that commitment to collaboration, this year's program offers multiple forms of CE credit, and I am pleased to introduce to you today Kathryn Reid, who is the lead nurse planner for our joint accreditation program.
Hello and greetings from the University of Virginia and the School of Nursing. My name is Kathryn Reid. I'm an associate professor at the UVA School of Nursing, and I just want to take a few minutes to talk with you about the importance of teamwork. And when I talk about teamwork, I want to talk about interprofessional collaboration and how this is so vitally important to effective patient care and great patient outcomes. So when we talk about interprofessional collaboration, we have to first start talking about interprofessional education and interprofessional continuing education. When we talk about teams and high-functioning teams, of course, I have to say something about our 2019 men's basketball team who worked so effectively together that they went on to win the NCAA Men's Basketball Championship. But this isn't without a lot of hard work. They have to practice together, spend a lot of time together, understand how each team member has their own role, their own job, their own skill set that they contribute to the overall success of the team performance and ability. And this is equally just as true in healthcare. For at least 5 decades, and probably even longer, we have research that shows that in hospitals where nurses and doctors communicate better and collaborate better, the patients actually do better. And probably 25 or 30 years ago, the Institute of Medicine launched an initiative to really promote interprofessional education. That if we can train nursing students, medical students, pharmacy students, social workers, students in the various therapy disciplines, that if we can train health professionals together in their educational program, they'll understand each other's role better and that will carry into practice. And so that then when these professionals enter into practice, they'll have a greater understanding about how to work with one another more effectively to achieve the best desired outcomes for the patients and families that they're taking care of. Here at the University of Virginia, we have a School of Nursing and School of Medicine right across the street from each other, and this close proximity really facilitates our ability to have students engage and learn with one another and with other professions and professionals as they master their craft and prepare to enter into practice. And so here we are in 2021, and health professionals entering into practice, working together, need to continue to learn and master the art of true collaboration, where professionals can come together and each individual professional can contribute their knowledge and skills in a meaningful way for optimizing care delivery for the patient. And so in order for the team to work well together, they have to understand each other's roles. They need to be able to communicate effectively. They need to be able to resolve conflict effectively. And most important, they need to be able to understand that which individual on the team is best equipped to meet the patient's needs at that particular moment in time. So healthcare collaboration is not easy. It takes a lot of effort to do it well. And so the training and education in the program is step one. But then we need to work to help all health professionals have a lifelong career of always promoting and dedicating energy to effective team collaboration. So the Institute of Medicine, now called the National Academy of Medicine, has listed interprofessional collaboration, teamwork, and communication as one of the top priorities for resolving some of our healthcare system deficiencies, particularly around quality and safety. So effective healthcare team collaboration is not an easy undertaking, and it takes a lot of work. And there is one important part of the solution in terms of continuing education. And so moving us out of our silos of continuing medical education and continuing nursing education and continuing pharmacy education and on and on and on, we are moving to a world where we are striving to have joint interprofessional continuing education. Here at the University of Virginia, we're one of just a very few number of academic medical centers that is jointly accredited to provide interprofessional continuing education, just as we are for this activity today. So this is education that is created and planned by the team, with the team, and for the team. And this is an important aspect of helping to promote really good, strong interprofessional collaboration in our clinical care delivery moving forward. Well, thank you for taking a few minutes to hear my comments about the importance of interprofessional collaboration and interprofessional education and continuing professional development. So now it's my honor to introduce your next speaker, Kathleen Haden. Kathleen Haden is an adult nurse practitioner here at the University of Virginia, and I've known her for many years. I first met her when she was working in the oncology area here at UVA, specializing in breast cancer care. So most recently, Kathleen works primarily with patients who are suffering from melanoma or various kinds of gastrointestinal cancers, including liver cancer, pancreatic cancer, bile duct cancer. She's also an amazingly forward-thinking practitioner, and she has a novel clinic that is dedicated to cancer prevention and identifying individuals who are at high risk for developing certain kinds of cancers and discovering ways to help prevent cancer in these high-risk individuals. So thank you again, and I know that you're really going to enjoy hearing from Kathleen Haden. Have a great day.
Hello, I'm Kathleen Haden, adult nurse practitioner at the University of Virginia, working in the Department of Surgery as well as in the Emily Curd Cancer Center. Today, I'd like to highlight where we've come so far since the Declaration on the War on Cancer in 1972. My whole nursing and nurse practitioner career has been in the field of oncology on all aspects. One of my loves now is going from actual treatment of the cancer patients to the avenue of prevention, control, and screening. I'm delighted to be a part of this program and want to highlight the importance of all healthcare providers and their role on this war on cancer. We've made so many crossroads and goals in decreasing mortality, and it continues to drop. But there's still so many disparities based on geographical location, race, economic inequalities, and even healthcare. We as a society have to have a wide health lifestyle and choices change. We as a society need to provide screening. We have all these new technologies with imaging, biomarkers, genetic testing, and we know there are certain things through science and research that we can now identify those who are at the highest risk of developing cancer. The problem and the issues continue to be the importance of all healthcare providers, nurse practitioners, physician's assistants, and physicians, of course, and what our role is in identifying those at the highest risk. It's truly difficult today to provide our 15 to 20-minute visit and capture not only their healthcare needs, but looking at the screening availability for our patients and making that happen. We have to discuss with our patients what they feel their perceived risk is and spend that time counseling. An interesting article by a Dr. Samimi from the NCI and prevention states there's been many perceived barriers with physicians and other healthcare providers in acknowledging all the basic facts in screening and using guidelines and tools to help our patients, because it is up to us as healthcare providers to help clean through the web, if you will, of all the information and all the guidelines and tools available to get those patients the proper screening or potentially offer them preventative therapies like tamoxifen or raloxifene for those at high risk for breast cancer. And it is our duty in those small visits to make us aware of our own perceived thoughts on the research and using evidence-based guidelines to help our patients better make decisions or get the screening they need. There's so many opportunities for our patients, so many programs that we could refer to for those that can't afford screening, or enrolling them in chemoprevention clinical trials or other radiology type trials. We need to educate, and organizations like Less Cancer, NCI, American Cancer Society, looking at different ways to bring us all together to educate the public, educate the healthcare providers, to offer the best screening and opportunities for our patients to live lives perhaps without cancer. I work running a high-risk pancreatic cancer screening program. Pancreatic cancer is scary for my patients. It's interesting to have this clinic there for those at highest risk and offer the services. And we don't just offer service for screening, which is an endoscopic ultrasound or an MRI, but we look at their other risk factors. Are they smoking? Let's provide a counselor for them. Are they obese, which is one of the biggest risk factors for pancreatic cancer? We provide nutrition counseling. We give them opportunities to take care of themselves so that they live the longest, healthiest, productive life possible, hopefully cancer-free. Thank you for listening.